just wanted to get on here and give you guys a quick update and let you guys know what happened last cycle. For those of you who have been following, know that last cycle was going to be our break. Well, sort of. Not really our break, but our break from going to the doctors and not using any medication due to some changes at work that I wasn't going to be able to take off some time off. So, results are in, and it was negative. Today is cycle day 5. So, plan for now this cycle. I called my doctor's office because everything's back in order at work, so I'm going to be able to see the doctors and take time off and whatnot. So I called the doctor's office on cycle day 1. I asked them, you know, to pass along a message to my doctor and let them know what I was going to be doing next. From my understanding, I thought we were going to do injectables. So the nurse that I spoke to over the phone, because she's the one that asked all the questions first, the nurse I spoke to over the phone advised me that I would probably have to take this cycle off because they have like a protocol that you have to follow before you get to injections. So you have to like set up an appointment with your doctor and have a discussion and a plan like for what the next step is. And then from there you have to take a class to learn how to administer the injections. Because I guess, I don't know, it's different. I'm not too sure. So then she said that that was probably going to be the case, but she would have to review it with my doctor and then they would call me back. So I was thinking, great, I could have done that last cycle when I wasn't going to have any appointments, take a break, go to the classes, make that around my schedule. And then they called me back, and she called me back and said, okay, so your doctor wants us to set up an appointment, so you do have like a meeting with him and get a plan. But since I had taken last cycle off, that he says that it's okay that I do my 6th round of Clomid. That totally scared me because I've heard of not being able, to not be taking that medication that long. So I asked her about that, but she said that this would be like the complete last, like they wouldn't tell me to do it again. But since I had taken, excuse me, since I had taken last month off, that it wasn't like all consecutive, so it shouldn't be like too bad. So I said, okay. I said, I'll go ahead. So we set up my appointment for my ultrasound to make sure there wasn't any cyst. And then she told me, because I actually saw a nurse practitioner, she's the one that can do the ultrasounds instead of having to see your doctor. So she told me that they were actually going to be upping my dose. So normally I was on 150 milligrams of Clomid, but now I'm going to be on 200 milligrams of Clomid to avoid any resistance. So if I would have had any resistance to the 150. So they bumped that. And then I set up my mid-cycle ultrasound, and of course from there we'll see how my little follicles are growing. And then we'll go ahead and figure out what day will be my trigger shot and the IUI, because we will go ahead and do another IUI. I wanted to show you guys like the medication and the trigger shot, just how they come for those of you who've never seen it or have done it, haven't even got to that step, but just are curious. So this is the Clomid. It's a bunch because they only come in 50. I don't think you can see. I don't think it's gonna auto. But yes, so it comes in 50 milligrams and I'm taking 200. So I've already taken my first dose today because it starts on cycle day 5. So this is how they look, how I get them. And then for the trigger shot. So the trigger shot looks like this. So it's just 2 little vials. This is just basically water, but sterile and clean. And then I would get some of this water. I forget what the I know what the measurement is, but I don't know what it exactly is. So I don't want to say it and be wrong. So I get this, and then we mix it in here, and then you give yourself the injection. Well, not myself, my husband, or I could do it too. They give you 2 needles. This needle is really big. It's fat. You probably can't tell, but it's really thick. And that's so it pops through the vials and you'll be able to mix that. So then you take that off and then you'll administer it with this one. It's much thinner. They've actually in the past given me a tinier one because I'm more petite, and this one's pretty long and thick, and they didn't give it to me this time, but I'll ask for it because I am not going to give myself a shot with this one because it's much thicker than the ones I'm used to. But that's it. Today is cycle day 5, and I think cycle day 9, 4 days, 5 days, I can't even remember, but I just take them until my medicine's gone because that's the correct dosage. But that is it. We did take a vacation about a week ago, and it honestly has changed like my perspective like completely. Not that I was a downer or anything like that, but it really helped me just come to realization that, you know what, it's gonna happen when it happens. I know all us TTCers hate hearing, oh, it'll happen when it happens, just relax, like we hate that, but honestly, on vacation it was amazing just to relax and to just get my mind off of TTC. And I just came back thinking, you know what, it's gonna happen. I know I am meant to be a mother, and it will happen whether it takes a long time. I mean, I'm not gonna be sitting here 10 years from now saying, hey, it's gonna happen. Of course, I'm gonna hope that it happens sooner than 10 years from now. But it's gonna happen, and that's kind of where I'm at right now. I'm just going with the flow this cycle. I'm gonna try not to stress about it. Just take my medication, go in, hopefully everything goes perfect, and if it doesn't work, then move on. We'll go on to the next thing and the next plan. But as of now, I'm just gonna try to stay as positive as I can and just kind of remain that way, and hopefully that helps me, I don't know. But that's it. Hope all is well with everyone. I hope I get to see more BFPs